Hello learners, welcome to lecture 34 where we focus on nutrition in childhood and adolescent health. Following our discussions on development, illnesses and immunization, today we will explore how nutrition forms the foundation for growth and resilience. Proper nutrition is essential not only for survival but also for optimal cognitive, social and physical development. Malnutrition, whether undernutrition, micronutrient deficiencies, or overnutrition, remains one of the greatest threats to child and adolescent health worldwide. Nutrition is central to child and adolescent health because it directly determines growth, immunity, and learning capacity. Good nutrition fuels the body, strengthens resistance to infection, and lays the groundwork for healthy adulthood. Conversely, poor nutrition increases vulnerability to diseases, reduces school performance, and perpetuates intergenerational cycles of ill health and poverty. Nutrition must therefore be understood as a life course issue, starting before birth and continuing into adolescence. The first 1,000 days, the most important ones, from conception to 2 years, represent a critical window for nutrition. Adequate nutrition during this period prevents stunting and wasting, both of which have lifelong consequences. Proper nourishment supports brain development, ensuring better cognitive function, school performance, and productivity later in life. Missed opportunities in this window are often irreversible, emphasizing the urgency of early nutritional interventions. Building on this, a life course approach prioritizes maternal nutrition before and during pregnancy, exclusive breastfeeding for the first 6 months of life, and timely and adequate complementary feeding from 6 months to 24 months with continued breastfeeding. Micronutrient sufficiency. Nutrients like iron, folate, iodine, zinc, vitamin A, plus deworming and clean water, sanitation, hygiene reduces infections that derail growth. Gender norms and intra-household food allocation shapes who eats what and when. Empowering mothers through cash transfers, maternity protection and counseling improves child's diets. On the ground, Anganwadis and frontline workers like Ashas, ANMs enable growth monitoring, IYCF counseling, that is infant and young child feeding counseling, and referral for severe acute malnutrition. Convergence across health, social protection, and food systems like Poshan Abhiyan, ICDS, and primary health services turn entitlements into real meals and measurable gains. Finally, equity focused tracking ensures that the most vulnerable infants are reached during the non negotiable window. Children require adequate energy and protection for physical growth, along with micronutrients such as iron, iodine, vitamin A, and zinc for immunity and cognitive development. A balanced diet includes cereals, pulses, fruits, vegetables, milk, and animal protein where available. Nutritional needs evolve with age and actively levels. Nutrition needs evolve with age and activity levels, but the core principles remain the same. Variety, diversity in food, and adequacy are essential for sustained growth and health. Malnutrition in children takes three main forms: stunting, that is low height for age, wasting, that is low weight for age, and underweight, that is low Malnutrition in children takes three main forms: stunting, that is low height for age, wasting, that is low weight for height, and underweight, that is low weight for age. Stunting reflects chronic undernutrition, while wasting indicates acute malnutrition, often due to infections. Underweight may result from both. These conditions increase vulnerability to illness, impair cognitive development, and limit productivity in childhood. Addressing malnutrition is central to child health and national development. Food insecurity, gender and caste hierarchies, unsafe water and sanitation, and caregiving constraints co-produce these outcomes. So, solutions must tackle both biology and social structures. Core interventions include optimal infant and young child feeding, initiation and exclusive breastfeeding for first 6 months of life, timely diversified complementary feeding, routine immunization, deworming and wash, that is clean water and sanitation to break the infection undernutrition cycle. Community platforms like Anganwadis and frontline workers enable growth monitoring and timely referral for moderate or severe acute malnutrition with ready to use therapeutic food where indicated. Social protection and women's empowerment improve household diets and care practices, converting entitlements into adequate intake. Finally, district dashboards with disaggregated data plus multi-sector convergence across health, ICDS, portion, education and livelihoods are essential to reduce stunting, wasting and underweight at scale. Micronutrient deficiencies are sometimes called hidden hunger because their effects are less visible but equally damaging. Iron deficiency causes anemia, leading to fatigue, poor school performance, and poor cognitive development. Vitamin A deficiency impairs vision and increases infection risk. Iodine deficiency results in goiter and developmental delays. These deficiencies are preventable through supplementation, food fortification, and dietary diversification, yet they remain widespread in many countries. Childhood obesity is an emerging problem worldwide, even in low and middle income countries facing a double burden of malnutrition. Unhealthy diets high in sugar, fat, and processed foods combined with sedentary lifestyles contribute to weight gain. Obesity in childhood increases risk of diabetes, hypertension, and heart disease in later life. Addressing overnutrition requires both individual behavior change and structural interventions, targeting food environments and lifestyle. Breastfeeding remains the foundation of infant nutrition. Exclusive breastfeeding for the first 6 months of life breastfeeding for the first 6 months provides all necessary nutrients and antibodies to protect against infections. Continued breastfeeding up to 2 years of age alongside complementary feeding supports growth and immunity. Breastfeeding also strengthens the emotional bond between the mother and the child. Promoting breastfeeding requires supportive health systems, family environments, and workplace policies. After 6 months, breast milk alone is not sufficient, and complementary feeding must begin. Appropriate complementary foods should be nutrient rich, age appropriate, and safely prepared to prevent infections. Introducing diverse foods early supports acceptance of different tastes and prevents deficiencies. Challenges such as cultural taboos, poverty, and lack of awareness often limit appropriate complementary feeding. Addressing these is vital for child nutrition. School age children need higher energy and nutrient intake to support growth and activity. School meal programs such as India's midday meal program play a critical role in ensuring adequate nutrition. They improve attendance, reduce anemia, and enhance learning outcomes. Balanced diets during this stage prevent both deficiencies and unhealthy weight gain, laying the foundation for adolescence. Adolescence, it's a period of rapid growth, second only to infancy. Nutritional needs increase significantly for energy, protein, and micronutrients. Iron requirements rise due to menstruation in girls, while boys require additional nutrients for muscle growth. Many adolescents, however, have poor diets with high consumption of junk food and low intake of fruits and vegetables. Addressing adolescent nutrition is critical for breaking cycles of malnutrition. From a sociological lens, gender norms, caste, and poverty shape food allocation, body image, and help seeking. So, nutrition efforts must tackle social as well as biological determinants. Practical levers include school based weekly iron folic acid supplementation, deworming, menstrual hygiene management, and nutrition education that builds label reading and media literacy against ultra processed food marketing. Safe, gender responsive schools and healthy canteen policies. Opportunities for physical activity and screening for anemia, BMI can catch risks early and link to adolescent friendly health clinics. Social protection like midday meals, take home rations for out of school youth, and targeted scholarship helps vulnerable families afford diverse diets. Finally, community engagement with parents and peer groups normalizes nutritious choices for both girls and boys, turning short term habits into lifelong health gains. Anemia is particularly prevalent among adolescent girls due to menstrual blood loss and poor diets. It affects learning, concentration, and physical capability, reducing productivity and well being. Programs such as India's weekly iron and folic acid supplementation targets this issue. Preventing anemia in adolescent improves maternal health in life, reducing risks in pregnancy and childhood later. Eating disorders such as anorexia nervosa and bulimia nervosa are rising concerns in adolescents, especially in urban areas. They are linked to body image pressures, social media influence, and psychological distress. These conditions cause serious nutritional deficiencies, psychological suffering, and even death if untreated. Addressing them requires awareness, counseling, and integration of mental health into adolescent health programs. Families play a central role in shaping children's and adolescents' nutrition. They provide the food environment, determining what is available and encouraged. Parental modeling strongly influences children's dietary habits and preferences. Emotional support also impacts eating behaviors, with stress or neglected linked to poor nutrition. Engaging families in nutrition education is vital for sustainable change. Schools are important platforms for improving nutrition. Nutrition education helps children understand healthy food choices. Policies restricting junk food and promoting healthy canteens shape their behavior. Schools are also platforms for supplementation programs such as iron tablets or deworming. Teachers and peers reinforce healthy habits, making schools a vital partner in promoting nutrition in childhood and adolescence. India has several public health programs addressing child and adolescent nutrition. ICDS provides supplementary nutrition, health services, and preschool education. The midday meal scheme ensures school going children receive at least one nutritious meal every day. Anemia Mukt Bharat targets iron deficiency across life stages. These programs reflect the recognition of nutrition as central to health and development. These are not merely food schemes but instruments of social justice, reshaping intra household allocation, tackling gender and caste disparities, and reducing the stigma that keep vulnerable children invisible. Convergence with Poshan Abhiyan, school health platforms, and adolescent friendly clinics links growth monitoring, deworming, hygiene, sanitation, and weekly iron folic acid supplementation. So, prevention and care reinforce each other. Program quality rises with gender responsive infrastructure, locally acceptable diversified menus, and community oversight through school management committee and village health sanitation and nutrition committees. Equity hinges on reaching out of school adolescents, migrant families, and children with disabilities through take home rations, flexible distribution, and targeted counseling. Finally, simply disaggregated dashboards plus social and behavior change communication co created with parents and peer groups convert entitlements into sustained improvement in diet, learning, and long term human development. Nutrition and education are closely linked. Malnourished children struggle with concentration, memory, and attendance, undermining learning. Conversely, well nourished children perform better academically and are more likely to stay in school. School meals serve as both nutrition support and an incentive for their families to send children to school. Investment in child nutrition is therefore also an investment in education and human capital. Gender inequities strongly influence nutrition. In many households, girls receive less food or lower quality diets compared to boys. This disadvantage contributes to higher rates of anemia and stunting among girls. Poor nutrition in girls leads to complications in pregnancy and impacts the health of future generations. Ensuring gender equity in food allocation is essential for breaking cycles of malnutrition. Communities influence nutrition through cultural practices, support networks, and collective initiatives. Community support groups helps mothers adopt breastfeeding and complementary feeding practices. Promoting local, affordable, and nutrient rich food strengthens dietary diversity. Community awareness campaigns challenge harmful norms and encourage collective responsibility. Harnessing this community power creates environments that support better nutrition. Malnutrition has broad social implication. It reduces educational attainment and productivity, limiting economic opportunities and trapping families into poverty. Countries face economic loss when large segments of the populations are undernourished. Malnutrition perpetuates inequality as poor families are more affected and less able to break free from deprivation. Addressing nutrition is therefore not only a health priority but also a development imperative. Undernutrition is produced by structural factors: lower wages, gender and caste hierarchies, food deserts, and insecure work, not just individual choices. So, solutions must be multi level. Investing in early nutrition for first 1000 days of life, Fortified staples, school meals, and social protection yields high economic returns by boosting learning, productivity, and lifetime earnings. Women empowerment, control over resources, education, and decision making consistently improves child rights and disrupts intergenerational cycles of deprivation. Local food systems that support smallholders and diversified diets make resilience affordable and culturally rooted. Finally, accountability through disaggregated dashboards and community oversight ensures resources reach those most affected, turning nutrition policy into equitable, measurable developmental gains. Media plays a powerful role in shaping nutrition behaviors. Campaigns promoting breastfeeding, healthy diets, and micronutrient supplementation raise awareness and influence practices. At the same time, aggressive marketing of junk food undermines healthy behaviors. Regulating advertisements and using media for positive health promotion are critical strategies in improving childhood and adolescent nutrition. Global initiatives highlight the importance of nutrition. The WHO Global Strategy on Diet, Physical Activity, and Health promotes healthy lifestyles. UNICEF's programs focus on early childhood nutrition, including breastfeeding and complementary feeding. The Sustainable Development Goals include targets to end all forms of malnutrition by 2030. These initiatives provide frameworks for aligning national efforts with global priorities. They reframe nutrition as a rights and capabilities issue, linking food environments, gender norms, and social protection to what families can actually eat and do. Countries translate these frameworks into convergence across health, education, agriculture, and social welfare. So, growth monitoring, IYCF counseling, school meals, and fortified staples reinforce one another rather than operate in silos. Accountability improves when dashboards track stunting, wasting, anemia, and diet diversity with disaggregation by gender, caste, disability, and location. And when communities co design local menus and behavior change campaigns. Financing and policy coherence like staple budgets, food safety standards, and marketing regulations on ultra processed foods turn global aspirations into everyday access to nutritional and affordable diets. Finally, embedding adolescent and caregiver participation ensures strategies are culturally resonant and sustained, keeping national efforts aligned with global priorities while responsive to local realities. Emergencies such as natural disasters or conflict disrupt food systems, placing children at high risk of malnutrition. Displacement, food shortages, and disease outbreaks worsen vulnerability. Emergency responses must prioritize children through supplementary feeding, therapeutic foods, and micronutrient support. Protecting nutrition in emergencies ensures survival and mitigates long term damage to child health and development. Technology is increasingly used to improve nutrition. Mobile apps track dietary intake, growth, and supplement use. Digital platforms provide nutrition education to families and adolescents. Food fortification innovations such as fortified rice or salt address micronutrient deficiencies at scale. Harnessing technology expand the reach and impact of nutrition programs, making them more accessible and effective. Nutrition challenges are multifaceted. Poverty and food insecurity limit access to healthy diets. Cultural barriers such as food taboos restrict diversity. Urbanization has brought processed foods and sedentary lifestyles, increasing risks of obesity. These challenges require coordinated, multi-sectoral approaches involving health, education, agriculture, and policy to create supportive environments for food and nutrition. Nutrition is a matter of rights, with every child entitled to adequate food. Ethical considerations demand equity in food access, ensuring vulnerable populations are not excluded. Governments have a responsibility to regulate harmful practices such as aggressive junk food marketing. Upholding ethics in nutrition means balancing individual choice with collective responsibility for child and adolescent well being. Future directions in nutrition focus on scaling up school based nutrition programs, addressing not only physical health but also mental health issues linked to eating behaviors. Sustainable food systems that balance nutrition, environment, and equity are critical for the long term. Nutrition must be embedded into broader development agendas, ensuring resilience against climate change and economic shifts. To summarize, nutrition underpins growth, immunity, learning, and productivity. Childhood and adolescence are critical stages where interventions yield lifelong benefits. Addressing undernutrition, micronutrient deficiencies, and obesity together is essential for holistic health. Nutrition is both a personal and social responsibility, shaping the future of individuals and nations alike. In conclusion, good nutrition is the cornerstone of health and development. It enables children and adolescents to grow, learn, and thrive while protecting against disease and promoting resilience. Poor nutrition, on the other hand, undermines health, education, and economic development. Investing in nutrition is investing in human capital and the well being of the future generations. As we close this lecture, I want you to reflect on the idea that nutrition shapes not just the individual health but the destiny of entire societies and populations. What children and adolescents eat today will determine their capacity to lead, innovate, and sustain progress tomorrow. Nutrition is therefore both a personal and collective responsibility. As health professionals and educators, our duty is to ensure that every child and adolescent has the opportunity to be nourished, healthy, and empowered for the future. So this is all for today's lecture. Thank you so much. In next lecture number 35, we deal with child protection and welfare services. Thank you.